Welcome back to Unique Adolescent Minds Unlocked. Dr. Goldston, let's dive in. I want to switch a little bit to teachers and parents and counselors, et cetera. Like, what can they actually start doing to help these children, or at least start the conversations earlier? And it might be difficult, like you said. How do you enter in non-judgmental and make the space safe for these kids to come to you and want to talk about it? Parents or counselors might also say, like, how do I know this is not them just trying it for one time versus just this developing into a long-term use? And so how do you distinguish, or what advice do you give counselors for distinguishing a one-time instance of experimentation versus actually developing a substance use issue?
Well, I'm not sure that you really do have a magic wand or can read anybody's mind. So, I think the most important thing is you have to set the stage for and coming at it from a place where you want to get to know somebody and try to understand what they're experiencing and ask the questions and try to create a safe space so you can inquire about what they're exposed to, what they may be experimenting with, and things like that. That's from in a school.
Yeah.
And schools sometimes get information. Students will share information about other students. Teachers have to spend extended periods of time with their students. They certainly get to observe what their students are like, and they also get to observe changes in what's going on with the students. But, let's say for an early adolescent, a colleague of mine here at Duke, Angela Tuno, and I helped work with the National Child Traumatic Stress Network in developing it was a document actually for military-connected families, and and one of us was helping parents to understand their youth substance use, and how do you set the stage for doing that? And there are general ways. The first thing is you can't just approach it as from the disciplinarian, here I'm going to play gotcha, whatever. Even if somebody has been using substances, it's important not to just get totally into the monitoring lockdown role 100%, because then people just become even more secretive and angry. You have to have some kind of part of your relationship that's over and beyond just to focus on substances, even if you are very concerned about that. But earlier on, before it becomes a problem, just trying to normalize the exposure to it and try to normalize conversations about it, like examples or things like just showing caring, like saying things like sometimes people use substances as a way of dealing with things when they're struggling with or trying to fit in. What do you think about that? Or what did you think, or how do you feel about a friend or a family member's substance use? Things like that. Or just acknowledging. I know kids drink or try drugs at parties or when they hang out with friends. I know there's sometimes pressure to join in, and just asking, like, when that happens, how's that gone for you? And just having these kind of general questions and asking if they, we've had certainly parents that brought their young people in that experimented. They were not at the level of having a problem, but maybe there were family members that have had alcohol or substance dependence problems. And they're very concerned that they don't want their kids are minimizing the effects of this. And a lot of that is based on information they got from their peers. And the parents are concerned because of family history, which is legit, right? And so they're bringing them in for an evaluation to make sure they don't have a more serious problem, but also is an opportunity to provide some education to the young person, so they can hear it not from the parents who they might dismiss, not from the peers, but from somebody in more of a position of, clinical expertise to try to share information. When you're ready for change, you have to approach that from a place of collaboration and working together with a person, because you can't make somebody change. You can't hit them over the head with it, right? You have to have to work with them to understand their motivations and try to help them understand the consequences of this, and you have to help them find things to replace the substance use with, right? You can't just take away something. You have to have something to replace it with.
Bingo.
But and so the treatment itself is much more collaborative, but sharing information, I think that sometimes, at least some young people are really interested in that. And even if in the room, but a part of this depends on how you do it, of course. But even if they act like they're disinterested, they've heard it.
Correct.
And some of that information may stay with them, and they may, hang on to some of that information.
Yeah. It's important. I think you talked about a lot about how do you have the conversations with not inducing shame in the individual, right? Not being a lecturer or seen as you're being defensive or coming down on them, because that only escalates like shame and hurt, and then like I'm in trouble, and then that closes them off more, that they don't want to have the conversation. So I love the fact of trying to put it on someone else, or if you had someone dealing with this, or if a friend was in this situation, how would they handle it to kind of put them at ease a little bit and relax, like I'm not on the stand or in trial right now. I just having a conversation with my counselor or my parent at this moment.
And the flip side of that, to not put people on the defensive immediately, is if somebody comes home and you suspect that they're high or drinking, that is absolutely not the time to be confronting them or getting them and pushing them into a corner, getting into an argument with them, or starting to lecture them. It's never going to work. It's just people are disinhibited. They're going to say things that they don't, you're going to get frustrated with teenagers. Teenagers get pissed at you.
Right.
It's not going to work out well. You have to wait until everything clears and they're able to be basically more sober, so you can have a conversation with them.
Yeah.
In a calm, control way, not with somebody standing over somebody, but sitting at a dinner table and kind of having this conversation with them.
Yeah.
And somebody sharing their concerns, but asking questions. But lecturing somebody when they come in the house and they smell kind of funny and they have blurry eyes, that's not, or you smell something on their breath, is not the time. Or if you do acknowledge it or whatever, just acknowledge it and let it go. But, we can talk about this later.
Yeah.
But not having the conversation right then and there.
Yeah, so timing is super important. Like you may be riled up as a person, like I want to get to this conversation, but just knowing when is my youth going to get the best out of this conversation and really going to sit down for some type of understanding. And it's not at the moment that they're intoxicated with whatever substance that may be.
I mean, you may have legitimate reasons for being all stirred up and really angry and upset about the disregard for safety a teenager has. They came in and from your perspective, they've done something incredibly reckless and dangerous, and that is, and you need to address that. In the context of what the expectations are and the house rules are in the home, that needs to be addressed, but not when they walked in the door.
Absolutely. Absolutely. I can agree with that. Let's say once a student is identified as a student with a substance dependence problem or a substance use disorder, what are the next steps that's non-punitive, like for a school counselor or a teacher to do, that can provide them with additional support or encourage them to seek help? How does one do that?
I think we've received some referrals from schools, but I think the primary way this usually works is people in the schools talking with parents and caregivers. And then the parents and caregivers can get in touch with us. And then if there's a uncertainty about the degree of whether or not there's a problem, we have people calling up on our triage line, and we'll have a call with them. I'm not sure if my teenager has this problem, but here's what I know, here's what they're doing. I think they do party a little bit. They use it for friends. I don't know if it's gotten out of hand. They may ask for an evaluation. And so that's the kind of thing that can happen in the context of a substance use clinic. And we certainly don't recommend the same a treatment plan for everybody. Some people have much more serious problems. Some people are very early in their trajectory. Their parents are insistent they're not going to use it all as long as they're staying there in that home and everything. So we help to support them with that and help to provide some education and help support the parents and trying to set these expectations, but doing it in such a way that they're still maintaining a good relationship with their kids, those type of thing. But for other people, they do, they may need to be in individual therapy, they need to be, or family therapy, or in one of our outpatient groups, or they may even need a higher level of, if that doesn't work and they're still not able to cut down or make changes, then they may need even a higher level of care.
I think what you hit on is knowing the resources in your areas and what's out there for you. So if you were a teacher, or a counselor, or even a parent that was confused and didn't know the next steps, even having a triage line where you can talk to professionals to say, I think this is going on. What should I do? Or counselors and teachers or counselors and parents having more of the conversation to get everyone, and importantly, the youth support system all on the same page of knowing what's going on. So kind of like more eyes can be aware. And then how do we further support them?
Mm-hmm. I'm going to give you another example. We've had people call our triage line, and maybe we had a wait list for therapy. But when you're talking to a parent, they're what they're feel that they're not even sure if a kid needs therapy,
right,
and everything. But they definitely don't want them to be using cannabis. They've made that clear. They otherwise have a really good relationship. They've talked with the kid about, being in treatment. The kid's not necessarily real happy about that or enthused.
right.
And, I may talk with them about if it still seems like it's not as frequent of a thing, and they, maybe first steps like urine drug testing.
Yeah.
And we may even offer advice on the kind of urine drug testing, because you can get urine drug testing where it's qualitative results, which is kind of like a urine drug screen where it can be positive or negative,
Mm-hmm.
kind of like a COVID test, yes or no. Or you can get quantitative test. I'm sure I've seen this on Amazon. I think a parent told me about this actually, where you can get levels of cannabis, because cannabis can stay in your system for 4 to 8 weeks if you're using it regularly. And so if you're waiting for it to get down to zero and they continue to stay positive, if you're just using the yes, no thing, you don't know if it's still negative, it's still showing that it's in their system. You don't know if it's just because you're still in the 4 to 8 week period, or if we're continuing to use.
Correct.
Right. And so it's really important to see the quantitative levels start to decrease. And another way to doing this is just working with the primary care doctor and seeing if you can ask them to order the quantitative test. But anyway, they can use urine drug test, and then they could use this in conjunction with incentivizing reductions.
Yeah.
So that's the other thing. It's you can't just use negative consequences, like locking people down and taking things away, or they'll lose motivation to do anything. So we try to. There are some natural consequences.
Of course.
You don't want to let your kid. Most parents are not going to be excited about letting their kid drive if they think they've gotten caught driving while inebriated before.
Right.
That's a natural consequence. Okay, let's get over this before you do that. Or sometimes parents will even say, I'm not going to let you go for your driving test until you get the cannabis completely out of your system, because I want you to have a completely clear mind. It's still a natural consequence, but it's also, you can link this to the incentive. You're going to get your driving privileges back, or you're going to be able to do your driving test, or other kind of privileges, things like that. So instead of, for example, saying, no, you can't see any of these people, and saying you can potentially see certain people, but we're going to monitor you to make sure that you're not using substances.
Yeah.
Sometimes just telling somebody you can't date a certain person,
change behavior,
or hang out with certain people, it just backfires. People will find a way. It's like a little Romeo Juliet thing, right? They can't do that and try to forbid the relationship. They're just going to find a way.
Mm-hmm.
But what you can do is you can put in contingents. Say, you can see if you can prove to us that you're not getting high when you're, hanging out with this person, that type of thing.
Yeah. Or even with the driving privileges, if you can't get there, you can still see the person, but now you have to find your own way to linking up or meeting with them. So it kind of gets still teenagers a reward in mind. I know I want to get my driver's license back, or I know I want to get access back to the car. How am I going to do that? By following this plan that me and my family came up together. Speaking of that, though, I was thinking along the lines of families having boundaries and certain like safety contracts with their youth that may be using substances. What do you recommend, or what is one critical like family rule or safety contract that you think that most people should have with their teens regarding engaging in dangerous situations?
Um, a single rule.
You can give me multiple. It doesn't have to be one.
The clearly people shouldn't be driving if they're under
Correct.
influence
Mm-hmm.
of any kind of drugs. And they shouldn't be in a car with anybody else while they're if a person is driving is drinking or high or both or
Right.
whatever, so that's a clear no-brainer. Some families, is probably an indication of a more significant problem, but, some families, sneaking out of a house at night
Yeah.
to go meet peers for, risky behavior, to get drugs or whatever, those type of things are things are going to be a hard stop. So we're going to set a hard limit on those type of things, sneaking out of the home in the middle of the night, because that parents feel that, how am I going to keep my kids safe if they're like trying to sneak out and going out to the park to meet people,
Right.
things like that. But those type of things, I do think it's important to keep open the conversation. Like if they find things, like if they find pills, they don't know where the pills are, you need to have those kind of conversations.
Right.
Because, with fentanyl, it's very easy to overdose on fentanyl,
Absolutely.
as an example.
Yeah.
And so they need to do that kind of monitoring and set limits around that.
Yeah, that's a higher risk of safety. I think when I think of families, contract, or commitments for safety, kind of prioritizing, that safety over punishment. Like, let's focus on safety and prioritize that versus you getting a punishment. And it leads back to something you said earlier, where some families, like, if you call and say you need help, we're coming to get you, and they kind of have this rule of no questions asked for that night. But we know we're going to revisit this conversation in the morning to talk about what happened. And so whether it is a rule over driving or a rule over sneaking out or a rule over no questions asked within that night or incident when it happened, I think it's important just to have those conversations or thoughts, because when it happens, at least you and the family member or you and your teenager has already discussed kind of what are the rules and what are the boundaries that we both agreed to in that moment.
Yeah, absolutely. Yeah, that's a great idea. And yeah, some parents will absolutely, if you're at a party, you can't get home safely. If you were the person that drove there, just give us a call.
Yes.
We'll come get you. That's all you need to do. Let's do that. And we'd much prefer you be safe than be out there on the road potentially hurting yourself or hurting somebody else even,
Absolutely.
So, just establishing those roles and expectations. I think and you were thinking about safety, that brought something else to mind, because the other population I tend to work with are individuals that have experiencing suicidal thoughts and suicidal behaviors.
Yeah.
And it's actually when somebody is having thoughts or urges to engage in suicidal behavior or has history of suicide attempts, and we're kind of doing safety planning and trying to figure out how to reduce the chances of this happening again or happening in the first place. One of the things we do is try to develop other ways that they can use to help help them to calm down and things like that, or to keep themselves safe, and identifying triggers and things like that. But one of the things that happens is that sometimes when people are using substances, we always try to provide education about substances, because these substances can actually affect your mood.
Yeah.
You can be at a party and start to be drinking with friends or taking pills or whatever, getting high with some people, friends, with the sole intention of just having a good time. But then you start to feel more and more depressed as the night goes on, and can really exacerbate some of those feelings you were actually trying to escape.
Yeah.
And make it more difficult. And then the other problem with alcohol or other substances is you can become more disinhibited, so you can become more or less likely to keep yourself, less capable of keeping yourself from acting on those thoughts when you are having them. So when somebody is struggling in that way, that's also another reason to really, we try to approach it very non-judgmentally with the young people, but as an educational thing, say it's kind of like putting fuel on a fire. Said you're already having some issues with emotion regulation right now and having a hard time. You're just putting something else on the fire. It's going to exacerbate and worsen those problems and everything, and make yourself less safe when you're having those kind of feelings. And so we always talk about this and provide education for that, for alcohol and substances in the context of trying to keep somebody safe.
Yeah, and I think it's also important, like even as parents or counselors who may not be as professional as you as a clinical psychologist or a psychiatrist, but just knowing that as well. Like if there is a kid that has like some suicidal thoughts in the past or maybe even suicide attempts, really trying to have that conversation with them about substance use as it can worsen those behaviors.
Right.
Right.
And we have those conversations with parents as well, because then they may have a different lens once they realize the relevance of that to the keeping the kids safe when they're having suicidal thoughts and suicidal behaviors. It's a different, they may have kind of a laissez-faire general attitude about alcohol and substance use, for example, if somebody seems to be doing okay in school.
Right.
But it takes on a different lens or a different perspective when you realize that it may make it more difficult for their son or daughter to keep themselves safe when they're having the suicidal urges.
Yeah, absolutely. And thank you for bringing that up, because I think that's important to know. In the line of safety, it's not always just substances. It's what it can lead to or disinhibit for other people dealing with those factors. What do you think is the most important message of hope and recovery for parents or counselors that's dealing with youth or teens that have or are currently struggling with substance use problems or disorders?
Well, I think that, okay, let's say somebody has a substance use disorder. It doesn't mean they're going to have this forever. There are effective treatments. Natural course in treatment is pretty variable and up and down. A lot of times if you take somebody that's entering treatment and you have where they want to go, it's not a straight line to get there. There you may be going in the right direction, and then there's going to be a few detours along the way. And unfortunately, that's just what happens. And it's not that we should just feel like we need to accept that, but we should try to reduce the chances of that. But when they do happen, we need to not just assume, treatment's not working and throw the baby out with bathwater.
Right.
We're not going to, say, treatment's not working. Why are we even paying to have this person in treatment? That kind of thing. What we try to do is learn from those situations. That's what a relapse prevention approach is about. Let's learn from those situations and those detours along the way, and try to bolster their sense of self-efficacy so they can learn from this experience, and it can help them going forward in the future. People have different levels of seriousness of their problems. Some people need a higher level of care. Some people need a shorter treatment course. But, people can have I have so many examples of people that have been in treatment and have had excellent outcomes. It's not that somebody is, and it's also not the case that the same treatment works for everybody. We have, very different treatment approaches, and we have, for example, referred people to certain types of treatment, and then we've had people get referred to us from that wanted a different approach. Our particular program tends to have a lot of referrals of people that have alcohol or substance use problems in addition to other co-occurring problems, right? During the pandemic, though, we were on lockdown. We weren't offering in-person services. And, particularly there might be, there were some young people, that, I'm thinking about young people with ADHD in particular. They had a lot harder. I'm just making
Yeah.
a generalization here, but my observation was they had a lot harder time with virtual therapy, right? And like getting engaged. They
Correct.
really needed to be with peers in person.
Yeah.
And so, we referred somebody, to a program that was in town or an adjacent town where we knew that they were having some in-person services because we knew they needed that in-person contact.
Yeah.
So it was different. Yeah, just like different clinicians, different treatment approaches, but it is something that is treatable.
Yeah.
And and we really want to help set somebody up for success.
Yeah. Absolutely.
And I think one of the things that happens with young people is that sometimes they're in treatment, they do really well, and then they assume they know everything and can manage things if they start to use again.
Yeah.
And then it goes sideways. We've had this kind of situation, for example, when people were they were in a process of recovery. They started to do well. They became abstinent from substances when they were in high school years, but said, I want to go to college. Everybody, parties and everything. I'm definitely going to do it then, but I've learned all these skills. I'll be able to manage this. And the next thing you know, you're getting phone calls about this and everything. People can overestimate their ability, but I think that's part of a learning and the developmental process is learning what you're capable of. And the way I think about this is everybody has their strengths and their areas that where they're more vulnerable. And it's important and they're not all psychological, physical, the same,
Right.
Everybody has their strengths and their vulnerabilities. And it's important to know that. And it's important to play to your strengths.
Yeah.
And so that can be a hard lesson if you want to be like your peers and go get, drunk on a Friday night or whatever at a party. But knowing that doesn't really work for you and learning that lesson can be a really important life lesson.
Yeah.
That's something learning and starting to accept something about yourself.
Absolutely. Absolutely. And so the biggest things I took away from that is like knowing that recovery is possible. Like there is hope for you to get better or people to get better. It's not a linear line, right? You're going to have some setbacks, but don't look at those setbacks as failures or that treatment isn't working, but instead, how do I learn? How do I grow? So then when I get back on this track or this trial, I've learned from that mistake to not let that send me back again. And then my circle of capability, knowing what environments I need to put myself in, knowing what the ability I'm able to do and what I'm not able to do. So I can kind of, in a way, stay away from falling back into that by thinking that I'm able to capably handle it, and I'm really not. I'm setting myself up for failure.
That's true.
In a way.
And I think another message is, and I want to be clear, I'm not advocating alcohol or drug use for any young people.
We're not.
We know enough at this point about the effects on the brain that that this is not a good idea, particularly binge drinking or substance use. And but with all of that said, I think is interesting that with certain, like with alcohol, we recognize that some people that are older that are drinking can have a glass of wine with their dinner or have a beer when they're watching a football game. And that can be the end of it.
Right.
And then there are other people who kind of, once they start to use or start to drink, they kind of they just remember where the accelerator is and they forget where the brake pedal is and they just keep going, right? You can't really stop until they're drinking a lot. So there's some people that are much more vulnerable and have much more difficulty stopping. So we know that's kind of accepted about alcohol, but there are these individual differences.
Right.
It's probably, there's a degree to which is that there's some of those individual differences with cannabis as well. That's a drug that people most often make a parallel with drinking about. And, even adults, some people use it socially occasionally, but then some people, they can't manage to do that. And they get a pattern of like basically being high, I'll say, all day long, right? Again, I don't think it's a healthy habit for any young person But I think it's important to recognize that, some people, sometimes it's a message that the kids need to know. Sometimes there are people that are especially vulnerable to the effects of these drugs. And yeah, of course, everybody wants to be like their peers.
Right.
But sometimes there are things that just don't work out for you personally, and we need to learn from those experiences.
Yeah. I guess
It's like somebody with diabetes. If you're a kid, developmentally, somebody may not want to have to watch their diet and not eat sugar or have to use insulin and everything because they want to be like their peers. We know this is something we have to do. This is our particular vulnerability.
Absolutely. Absolutely. I was just going to piggyback on that. So I'm glad you went there. But yeah, what others can do, I may not be able to because I may respond differently for it. So if I see Johnny drinking and not having any effects on his grades, if I try to be like Johnny, it may be a different outcome for me. And I have to realize that and understand that. Dr. Goldston, thank you so much for talking with us today. I hope our listeners to understand how they can help their adolescents if there is a concern or suspicion for substance use. Subtle behavioral shifts are the early warning signs. Being proactive, observing, understanding, talking with your children, looking for changes in their function and their emotions, really, really paying attention to your youth. Substance use makes the brain more vulnerable to these subtle changes, structural changes. And so substance use can be co-occurring with mental health problems, depression, anxiety, ADHD. How do we teach our adolescents to not self-medicate and instead find different coping mechanisms that can help them through? And support from a psychologist, from a psychiatrist, from peers, from their community, and how we can continue helping our youth and adolescents develop into the wonderful people or wonderful individuals that they're going to be for the future.
Oh, exactly. Yeah. Thank you so much for having this conversation with me.
Thank you.